Welcome. I'd like to acknowledge the local custodians and the land in which we meet today and honour elders past, present and emerging. I'm Melissa Wilkinson from the education team with the Hunter New England Central Coast Primary Health Network. Just a little bit of housekeeping to start off. If I can ask everybody to please remain on mute. And there will be a poll at the end. This is the way that we get feedback from you. It's an evaluation survey and I encourage you strongly to please complete that. It is recorded today and will be available on our website and the education library. There's a questions box on the right hand of your screen and a chat box. I encourage you we'd like this to be as interactive as possible, so please pop questions in there. We have Kimberly Booth today and John Bailey, Exec Manager and COVID-19 Response Lead online as well. They're here to help answer questions that you may have. So we strongly encourage you to put them in there and we'll get to those towards the end of the session. I'd like to hand now over to our presenters, Donna Block and Casey Wisemantel. Over to you, Donna. Are you right to go?
I think Donna's having some technical problems, Mel, so yes. I'll get started. Thank you so much.
Fantastic. Thanks, Casey. Okay, over to you, Casey.
So hi, my name is Casey and I'm a former practice nurse and I was involved in developing these preparedness resources with some of my team members. So if you're here today, you would already be familiar with today's learning outcomes. However, we'll be going over all of the preparedness documents as well. We'll just have a quick look at them. We'll try and get through these quickly so that you've got time for questions. As we know, you will be starting the vaccine rollout in a few weeks. We also have John Bailey and Kim Booth here with us as well to assist you with any questions that you have about your practice setup and what's involved. They're a part of the COVID coordination team. So as members of the primary care improvement team, we've used our experience as general practice managers and general practice nurses to collate these resources that will allow you to be prepared for the rollout of the vaccine in your practice. These tasks have been broken down to include all staff members who are working within your practice. So that's from your admin staff, your MPAs, your practice managers, practice nurses and GPs. The links are provided in the documents in case you require further information. Please note, they're not required reading. We know you are already working hard in getting prepared, and some of these things you may have already done, and that's great. All 5 of the checklists and a communication strategy template are available on our PHN website under Programs. You then scroll down to the COVID-19 Vaccine General Practice Preparedness, and your Primary Care Improvement Officer can also assist you to work through these checklists if there's anything that you're not sure about. So we're also in the process of developing a toolkit to complement the Department of Health information. This will assist you with ideas for setting up clinics within your practice. We anticipate this being available for you to use as from early next week. So don't forget that in addition to the resources available on the PHN website, you also have access to information in your respective health pathways. Please let us know if you require the username and password to log in. And you'll also be able to refer clients to patient info for up-to-date information on the COVID-19 vaccine and how they can access it. As a reminder, every clinical staff member involved with the rollout of the COVID-19 and administration of the vaccine must complete the mandatory online training modules and any updates as they are released. It's also highly recommended that your admin staff also complete the non-clinical modules. All staff who complete the training need to provide the practice manager with a copy of their certificate of completion prior to commencing any COVID-19 vaccine clinic. We know you've got this. Think back 12 months ago. You were dealing with a pandemic and none of us had done that before, and you got there, you made it. You are also in the midst of a pandemic and managed to vaccinate for the flu in record numbers and still keep up with everything else. You kept your patients safe and all of your staff too. So yes, we know you can do this. The main changes you will notice with COVID-19 vaccines is simply around your ordering and reporting processes. I'll now hand over to our PHN COVID-19 vaccine coordinators, John and Kim, and they'll answer any questions you have regarding this. Thank you.
Thanks, Casey. Mel, got some questions for me?
Yeah, sure. So we've got to have a couple that were submitted previously. So the first one is, when can I vaccinate staff?
So what we're advising practices is that they can vaccinate staff as part of the 1B cohort. What we are saying to practices, please don't give all of your staff the vaccine on day one or even in week one. Spread it out over a couple of weeks so that you do two things. One, you do allow some of the public to be vaccinated, but secondly, you don't put at risk the operation of your practice by giving all of your staff the vaccine in one hit. So it's perfectly appropriate as part of 1B to do that. I personally would start with the highest risk group in the practice, and those are people who are either swabbing or particularly GPs and nurses who are working in closer quarters with patients.
Great, thank you. What if the patient doesn't have a Medicare card or they're not covered by Medicare? What happens then?
Good question. So not everyone in Australia is covered by Medicare. The onboarding kit and the other material that's been provided provides advice on that. But generally speaking, what we would draw your attention to is the fact that the GP respiratory centres are set up to do vaccination for non-Medicare card holders.
Great. Do we have to use the online system?
You don't have to use the online booking system. And what I might just talk a little bit about is the system for people to check their eligibility. So the government have established an eligibility checker. You can see on the screen now the hyperlink at the top to that. That eligibility checker will allow people to work out whether they're in phase 1B, 1A, 1B, 2A, 2B, or ultimately phase 3. From mid next week, that eligibility checker will be built upon, so it will be added to allow people who meet the criteria to then go through and find out where their local practice is or where the practices nearest to them are who are administering the vaccine. Those addresses are really vital for you to check when you do your onboarding site registration between now and Saturday of this week. Make sure that the address that you are administering the vaccine is registered there and is accurate, because if it's inaccurate, it won't appear properly on the location finder that will be built in to the vaccine eligibility checker. Once someone is determined as eligible, there'll then be a link to either the, so there'll be a card which gives them a details of the practice. There'll either be a link to the online booking system if the practice already has one and had nominated that as part of their site registration, or alternatively, their practice can elect to use the Commonwealth's booking system, which will be available from next week. And finally, if they don't want to do that and they want to manage things through the telephone, just don't put in an online booking system at all, and your telephone number will be provided to the public by way of the site information card.
Okay, great. What do I do if I have no site reg code?
Okay, if practices who are, particularly practices in week 1, don't have their site registration codes, so there are 2 codes. If you do not have those by this afternoon, please let us know so we can follow up with the department. If you have those, can you please go through and do the registration? For practices in weeks 2, 3, and 4, they will progressively come to you for site registration. So we'll alert you to when those week site registrations come out for each of the subsequent weeks.
Okay, the next one is clarification on the requirement of a barcode scanner. And Angela's saying that she can't see the serial box in BP Saffron, that this can't be entered manually.
So there are two things. One, just in relation to your desktop software, make sure that you may have the most current version, because it will ultimately have the serial number available. If you're running an older version, it will not have the serial number there, and you'll need to have a look at that. We have tested some barcode scanners, and we've determined which ones work well, and we are at the moment seeing if we can secure a bulk supply of those to provide to practices. So you'll get some comms from your PCIOs in the next few days about the availability and the suitability of barcode scanners. If you continue to have problems with the serial number being grayed out, then please contact your desktop vendor and they'll be able to help you with that. It may be that it doesn't get turned on until the vaccine is confirmed as being available. And just remember, there are two numbers. There's the serial number and the batch number, and you need to put both in.
Okay, next one's on documenting proof of eligibility. What's the expectation here? How comprehensive is the information supposed to be in the record? Obviously, for some populations, it's not really an issue, and we're aware that the focus is more on getting people vaccinated rather than holding back vaccines.
Yep.
So
yeah. If people come through the eligibility checker to then go through to an online booking system, that eligibility is checked by the eligibility checker that you can see on screen now. If they don't meet the eligibility, they won't be able to get through to the point where they can book. So that's the first thing. So again, encourage people to have a think about using that. In terms of checking the eligibility at the point of your practice, in your onboarding kit, there is a detailed section around eligibility checking, including the documents that are appropriate to cite to be able to confirm that someone meets the criteria. Can I just say to you, here's another way that you can approach this. So we know that the vaccine for cohort 1B is targeted at people over the age of 70, over the age of 55 if they're an Aboriginal or Torres Strait Islander, or if they're a young person with an underlying health condition that was defined in the onboarding kit. Then what I would suggest to you is do it this way. Run the pen tool or the appropriate data extraction tool over your practice database with that particular recipe running so that you extract the cohort for 1B. Once you've got that list, sort it by risk. So those at the highest risk at the top of the list and those with the lowest risk at the bottom of the list. Then think about the way that your practice operates and consider proactively reaching out to that cohort, either through your SMS or emails or whatever method you use, and saying to them, look, from the week beginning X, whenever X is for you, whether it's the 22nd or the week after, we will have vaccine availability for your cohort. For your age group or your condition group. Reach out to them proactively and encourage them in waves to book with you. So if you're going to get a supply of vaccine, make sure that you reach out to enough people to be able to fill those slots. My suggestion is to slightly overbook that. So in week 1, most practices who are beyond week 1 going to get an allocation of 100. In week 1, they will get an allocation of 80 doses, and I'll cover that in a minute. So basically reach out to 85 people in that first week. If you take 5 off for your staff, if you're getting 80 doses, reach out to 75 people. Hold 5 doses back for your staff and start immunising your staff, and reach out to those 75. If your practice gets a lot of no-shows routinely, consider bumping that up to 80, knowing that you'll get some no-shows and you may have to, towards the end of the week, delay them. Let me just give you a little bit of thinking around how you might actually run the clinic. You can do clinics in a couple of ways. You can dedicate some block time to doing clinics, In other words, let's talk about a practice getting 100 doses a week. You could do a clinic on one day to try and get through 100. But if you turn that around and think about it another way, if you're getting 100 doses, you divide that by 5 days, Monday to Friday. You don't want to be doing vaccinations on a Saturday because it's a short day. So do Monday to Friday. Divide the 100 by 5. That gives you the number of vaccinations you need to do per day. If you then divide that by 8 hours per day, you will find that you are down to an hourly rate. So 100 doses available to you, 5 days in the week, that's 20 per day. Divide that by 8 hours, it's 2.5 people per hour, which is not a huge ask. It's, you know, an additional 2.5 people. So think about the way that you want to manage your clinic. Talk to your GPs, talk to your practice manager. If you want to do it in a 100 lot, that's your decision. But if you also want to spread it over the week and do 2.5 people an hour, or let's round it up or round it down, 2 or 3 people an hour, it's a much easier way to manage it. Hope that's been helpful. Mel, sorry.
Oh, that's great. Thanks, John. Has anyone heard anything about the telehealth item numbers? Are they still ending on the 31st?
We understand that there will be an announcement in the next 5 days around that.
Okay.
And that's all I can say. Sorry, I'd love to be able to say more, but read between the lines. Yes,
fair enough. Is it a requirement that we must check up or upload to MHR?
I can't answer that. I've not checked. It's a requirement that you load up to the AIR, and your software should do that automatically. We'll take that, the My Health record, on notice and come back to you on that. So that's a question for the team to do some research around.
Okay, so the next one is, are practices vaccinating 1A patients who have not been to vaccine centres elsewhere?
So 1A patients are essentially quarantine border workers, frontline hospital staff, right? So let's be really clear about that. That's frontline hospital staff, aged care staff, disability staff, aged care residents, aged care staff. Aged care facilities are being done by an in-reach model, and they should be taken care of. If you do have them present, please confirm, particularly staff, make sure that they haven't already had the vaccine on site at the facility. For quarantine and border workers, other than Newcastle, there are probably not many places that will be exposed to that. So those quarantine and border workers are being done by the local health district. Look, they may come to you, and I'd suggest you have a conversation with them about it. They are eligible for the vaccine, whether it's the Pfizer vaccine through the hub or the AstraZeneca through you. So the challenge there is just to make sure that they have not already been vaccinated or started down the course of vaccination, particularly down the track. So, you know, if someone's had a first dose of Pfizer at the hub, what we don't want them is having a second dose of AstraZeneca at their general practice. Encourage them to go back. The other thing with that is when you do start vaccinating your patients or patients at your practice, there is a 12-week period between the first dose and the second dose, right? So what you need to do is try and lock them in for the second dose, give them an appointment for the second dose 12 weeks out so that you get the PIP payment, okay? So make sure that you try to give your patients a future booking for it. The other factor to consider in this is that we're about to have influenza vaccine available as well, very shortly. There is a prescribed 2-week period between the COVID vaccine and the influenza vaccine. So if you think about it, if a patient has their first dose of COVID vaccine on the 22nd of March, there's a 2-week period before they can have the influenza vaccine, and then there needs to be 2 weeks before they can have the next COVID vaccine. But with a window of 12 weeks between the first COVID in the second, you got plenty of time to do that. So here's my suggestion: split the difference. Give them a influenza vaccine booking at week 6. So they get their COVID one at one point. 6 weeks later, they get their influenza. 6 weeks later, they get their COVID second dose. Job done. Thank you very much.
Okay, great. I've actually written that down for myself. International students now. International students do have insurance and it covers them for all Medicare item numbers. Can we immunise these eligible students and bill their insurers?
I will take that on notice. I believe they are in the Medicare ineligible group and should be done by a GPRC or a hub, but we'll take that on notice. It's a really good question, particularly in communities where we've got relatively large overseas student university populations. So we'll come back to you on that. That's a good question, thanks.
Great. Do we still need a bar scanner?
No, you don't need a barcode scanner, but just be aware that the serial number is an 11-digit number. I'm not good with 8-digit phone numbers, let alone 11-digit numbers. So, you know, it's entirely your choice. Using a barcode scanner should make it easier. It should make it easier.
Okay. Can a practice start off using their own booking system, phone number only, and then change to the government online booking program later on?
I don't know. Take that on board. What you will be required to do is when you do your site registration, initially you'll need to nominate an online booking system if you have one, or nominate to use the government's one, or alternatively use a phone number. Can you change dance partners halfway through? I don't know, but we'll get some advice on that.
Okay. Is there any information available online for non-Medicare eligible patients where they can get vaccinated? Previously, RACGP has said that non-Medicare eligible people have got to go to government clinics. Is that correct?
Yes, and that's what we mean by GPRCs and hubs. Yep, that is correct. And that advice will be part of the national comms when it comes out, and we'll make sure, particularly in the communities where we've got universities, that we will highlight that in our local media comms as well.
Okay, so the next one is, I'm an authorised nurse immuniser. Where can I find a copy of my certificate?
Casey.
I would say contact the PHU. I've kept mine, and I did my authorised nurse immuniser course over 10 years ago, so there was no electronic versions available. So you could probably follow up with the PHU. Oh, excuse me.
Yep.
Okay, thanks, Casey. Re-documenting proof, but what do we write in our medical record re-proof? Example, cited employment card identified as XXX for medical record.
You need to document that you've cited the documents that are listed in the onboarding kit, and it can be as simple as cited the eligibility documents, you know, and you can either write license, whatever, Medicare card, whatever. So you can write them in full, or you can just say that you've cited them. The issue is about making sure that the vaccine gets to the people who are at greatest risk. That's what the eligibility is about. What we don't want is a stampede of otherwise healthy individuals in the first instance. What we want are people who are at risk being vaccinated. And by the same token, we don't want vaccines sitting in fridges. I've said it quite a few times, the vaccine doesn't do us any good if it's sitting in a fridge. It only works if it's in an arm.
Okay, in the case where people from 1A come in and they want AstraZeneca, not Pfizer vaccine, given at the hub, can we do that?
Yes.
Yep.
They'll need to be able to prove they meet the eligibility criteria for that group. So somehow they'll need to be able to prove that they are either, you know, border or quarantine staff member, their LHD ID or their other frontline health worker priority group ID, or that they are, an employee of an aged care facility or a disability sector.
Okay, there's a question here about a practice saying that maybe they don't want to be on the list and they only want to vaccinate their own patients. How do they arrange that?
Okay, let's open this can of worms up, eh? So when you signed up, you agreed that you would vaccinate people in those priority groups. I would suggest that if you want to vaccinate your own patients, then what you need to do is be proactive about that. Just do what I suggested before, which is to run the pen tool or whatever data extraction tool across your population and pre-book your bookings. So that then if I ring up and I'm not a person who's from your practice, what are you going to say to me? You're going to say you don't have a booking, right? When we get down to 2B and potentially 3, it may be a different situation and you can reassess it down then. But the idea is to get this vaccine to as many people who are eligible at the time that they are eligible in the safest and most efficient way. If your practice can't see people from outside, then you need to think about that. But as I've said, I've given you a model where you will be able to, if you like, front load your bookings by stratifying and identifying your patients who meet the eligibility criteria.
Okay, any updates for practices needing to postpone from the 22nd to the 29th?
If you do not want to start on the date that's been allocated to you, please contact the email address on the screen now. And do that urgently, because what we want to do is, if you're not going to start, we want to redistribute that vaccine to someone who's keen as mustard to start, and there are plenty of them.
And sorry, John, it's Kim here, just to jump in on that one. Can I particularly encourage, if you have been aware that you're in week 1 for commencement, we need that information by tomorrow. We need it ASAP if you're wishing to delay.
Yep. So if you're not going to go ahead on the 22nd or even the week later, please email us this afternoon. Do not leave it, because the vaccine is going to get started to be delivered sometime between the middle and the end of next week. And that's why we need to know whether you're in or out.
Okay, do accredited nurse immunisers have to have an up-to-date CPR certification if working with a GP in the clinic?
Yes.
Yeah. Is 100 doses a week the only allocation to authorised practices?
No, practices will get a variety of doses. Some practices will get 50 doses per week. Some practices will get 100, some will get 200, all the way up to 400, I believe, particularly for the first 4 weeks, right? So for the first 4 weeks, those vaccine numbers are capped. After that, it will be reassessed by the Commonwealth, because what we're dealing with at the moment is a limited supply of the vaccine. So the numbers that you've been allocated are calculated on what we believe to be the available doses in each of those weeks. And as you can see, that's incrementally getting more, right through to when nationally we'll have well over 4,500 sites vaccinating, plus hospitals and other settings, GPRCs, AMSs, etc. So the numbers for the first 4 weeks and possibly a bit longer will be fixed and capped, right? Now, if you're a practice whose allocation has been a 50 allocation per week, just be aware that you will get a box with 100 doses in it, right? So your delivery will contain 100 doses, that's 50 per week, and you'll get a fortnightly delivery. If you want to use them all in the first week, that's your you know, you can do that. You can do them all in the first day if you've got the capacity and capability to do that. But the available doses to your practice are as previously notified in your letter of eligibility. And the ordering system will not allow you to order more than you have been allocated. And you will also receive the consumables to match that. So you'll get needles and syringes to match the doses that are coming to your practice, right? You will get sharps containers for your practice. You will not get Alco wipes and you will not get skin swabs, etc. You're responsible for those, but you will get needles, syringes, and sharps containers. That's clear in the onboarding kit. The other thing that I would say to you is, please do not transfer vaccine vials between practices, particularly in the first month to 6 weeks, and even beyond that. The reason for that is that the vials have been allocated based on population and a whole number of other factors. We want to be able to make sure that the vaccine's getting to the right place. The other issue with transferring it is we cannot guarantee cold chain management if you move vaccines from one site to another unless you have the appropriate portable vaccine fridge, data logger, etc., etc. So please do not transfer vials of vaccines between sites unless you get express approval from the Commonwealth to do so. And that will come via the email address on your screen.
Okay, the Astra vaccine has a 6-hour room temp viability and 48 hours after the first using the multi-use vial. Can you draw up in advance? For example, the night before a clinic.
Casey, do you want to take that? My advice would be not to do that.
Definitely not. If you're clinical, that is covered in the modules. It does say the stability of the vaccine after drawing it up into a syringe has not been studied, and it therefore should be administered immediately after being drawn up. So that's all in your online training modules.
So
Okay,
again,
great.
if I go back to the model of operating the clinic, you know, 100 doses, 5 days a week, divide that by 8, two or 3 doses an hour, there is no need to draw them up in advance. That's no different to your normal flu. Come on, you guys do this every year, year in, year out with flu. You know, you're actually better at it than most people at doing this. So give yourself some credit and don't overthink it. Break it down, as I say, Barney style, step by step by step, and think about the way that you would normally do a flu clinic.
Okay. Wondering about what we do to obtain a patient health record for patients not known to the practice.
So if a patient is not known to the practice, then the onus is on the practice administering the vaccine to obtain the history at the time the patient presents. And that is challenging, particularly for the 1B group whose history is going to be complex and in some cases detailed. Again, that is covered in the onboarding material, but again, I would strongly suggest that you try to reach out to your patients and get them in. You don't need to necessarily do that if you proactively reach out to your patients. Patients who don't have a regular general practice can go to a GPRC or a hub once they open up for vaccination beyond the 1A group.
Okay, a practice has asked if there's somewhere they can send people who indicate they've had a previous anaphylactic reaction to receive the COVID-19 vaccine. The GPs are concerned about the risk. Could it potentially be sent to a GP respiratory clinic, or alternatively, is there a support line that can be called to discuss these patients as they don't want to turn them away?
So the GPs certainly can contact the vaccine support line. That number is the Health Direct line. However, my advice to that would be that they have a chat to the GP who's operating the nearest GP respiratory clinic and have a discussion about what's the best way to manage that. Noting that, of course, this should be a very, very small number of people based on the overseas experience. You know, the incidence of anaphylaxis globally is actually quite low, and people with a history of anaphylaxis, you know, they're well known to those people. It's the random one that just turns up that's more worrying. The ones who we know we can manage by rediverting them. And it may be appropriate to delay those people and they go to a clinic later.
John, they can also contact NSWIS, so New South Wales Immunisation Specialist Service. So the number is 1800 679 477.
Yep. Good
Well
advice.
done. Okay. So what happens in the scenario where someone has dose 1 at one practice and presents for dose 2 at another geographically distant practice, for example, travellers?
So where that occurs, I'm going to assume that they've managed to get an appointment at both places. Where that occurs, they can they'll be able to do that. The AIR will have a record of their first dose, so that will be available to the second practice, if you like. The issue there is that neither practice will get the PIP because they're only administering one of the 2 doses that are required to get the massive $10, I think it is, PIP payment, isn't it, $10? So, you know, again, it shouldn't be a huge number of people, but we're really trying to encourage people to get a regular general practice into your life. This is a really good opportunity for practices to make sure that they link with their population and do have a connection with them.
I think we might have covered this one already, but a GP is just asking, do we need to order the vaccines or will they come automatically?
Okay, you need to order the vaccine. And that is what the portal is about. There are cut-off dates for ordering and they're clearly spelled out in the onboarding kit, and they will also be in the portal. So you'll have plenty of prompts for that. Those order dates are hard dates. They can't be flexed because the vaccine needs to be packaged, labeled, and delivered from central spots. So they, you know, it's not like ringing up for a pizza. You can't decide at the last minute that you need to one. You need to plan this out and think in advance.
Okay, so we've got a couple more to go. When reading the vaccine suitability assessment information, there was supposed to be an item number for time spent, even if the patient's either declined to think it over or was unsuitable of the day. There does not appear to be an item number for this. Is this the item 3 to be used?
I'm going to take that on notice.
I can jump in there.
Oh, thank you, Kim.
I can jump in there, only that I can direct that query to the MBS have actually released a fact sheet that relates to those specific set of MBS item numbers, and there is a clause in there that details whether that item can be claimed twice for the same patient for exactly that reason that you just spoke of, Mel. So I would recommend that you would go to either the MBS has a link. If you go to the MBS online, you can access a link to a PDF of that. It's not a frequently asked questions, it's more of a really detailed explanatory document.
Yeah, and look, as I recall, there are example cases that have been walked through, so that it helps you understand that, you know, if a patient comes along and you do the session with them to determine their eligibility and their appropriateness, and then they go, oh, I want to go home and think about it, and then come back a second time, that's all covered in those case scenarios. So what we might do, Mel, is we might try and find the link to those and circulate them as well.
Okay, for sure. There are practices that won't be using online appointments, and they're assuming that that still will remain non-mandatory. Is that correct?
It is non-mandatory. You can have a telephone number. So the process is when you are being onboarded and you are registering your site, you need to nominate whether you want to use your online booking system, your existing one, whether you want to use the Commonwealth one, or whether you want to use a telephone number. And if you want to use a telephone number, you need to confirm the telephone number when you do the site registration. And that's really important because that then gets pushed through to the service finder through the eligibility tracker. So if you're going to use a different phone number to your normal practice number for people booking for COVID vaccine, you need to make sure you've got the right number in the site registration details. So if it's a different number to your normal practice number, check the numbers, right? It will be pre-populated on what you put in your EOI, but check it because you need to make sure it's the right one.
Okay. Would capacity tracker also be a way to alert PHN of practice delays in vaccination?
Yep, okay. So I've had a few questions about why we would use capacity tracker as well as the government's online system. So the ordering system for the government is really just that, for ordering. What we're keen to do is also monitor that and work out who's vaccinating, who's not vaccinating, and what the current state of live practices is at any given time. We can't rely on the government system to do that. So what we're asking you to do is let us know how you're going through capacity tracker. So let's take a scenario. Let's assume that we're a few weeks down the track, people are vaccinating, and a practice finds that a couple of their staff are off sick. You know, they're sick for whatever reason. They may then suspend vaccinating for a week. If they alert us through capacity tracker, we can make sure that the Commonwealth are aware of that, and we can make sure that they are not being pursued about not using their full load of vaccine. And we can also then help the practice change the setting on the eligibility system. Sorry, I need a cup of tea. So that's why we'd like to use capacity tracker. What we're really trying to do is take a wee bit of the load off you by working it between you and the Commonwealth. So it's really important that if you're not registered for capacity tracker, get yourself registered. You'll also be able to order PPE through there if we have another cluster outbreak and commercial supplies are problematic. So, you know, there's lots of reasons for doing that using capacity tracker. And into the future, we'll build on the functionality of capacity tracker to do other things like, you know, manage situations like bushfires or other natural disasters.
And I guess, John, I was just going to add to that too, that by us trying to encourage everyone, as many people as possible, to register and use and keep it updated is certainly not the PHN trying to give you an extra task or add to your current workload. It's us saying, help us help you.
Yep. Look, you know, the scenario where a practice might have a couple of staff off sick, if we know that, we may be able to help them find some additional workforce through nurse immunisers who, you know, we put some scholarships out there, so we are helping nurses get trained for nurse immuno. So, you know, we can do what we can to help you, but if we don't know what's happening locally, we can't help you. The Commonwealth system is around the ordering and delivery of vaccine and the consumables. The capacity tracker is about helping you do the day-to-day and stay on top of it.
Are enrolled nurses considered nurse immunisers too?
Sorry, I can't hear you, Mel.
Are enrolled nurses considered nurse immunisers as well?
Casey, this is your area of expertise.
Oh, sorry, I'm just trying to bring my screen up. So in regards, I've lost everyone. Sorry, I'm having technical difficulties myself. So in regards to RNs and ENs being able to administer the COVID-19 vaccine under medical officer's order. This is a statement on the AHPRA website. So registered health practitioners who are trained, educated and competent in all aspects of vaccine management and administration, and who are authorised under relevant state and territory drugs and poison legislation, the medicines legislation, can administer vaccinations during the COVID-19 vaccines. These registered health practitioners are usually medical practitioners, often a general practitioner, nurse practitioners, midwives, registered nurses and enrolled nurses under the supervision of an RN. So the answer to that is yes, if you are educated, authorised, confident and competent to administer a vaccine and you've done the online COVID-19 training, you are eligible to administer the vaccine.
Okay, great. So will it be the normal sharp collection agencies for waste that will collect the sharps?
So the Commonwealth have been really kind. They're going to supply you with the sharps containers, but they're not going to take them away. So that's actually your normal disposal process for those sharps containers. It's a bit of a, half a gift.
Okay.
I'm going to have to wind up shortly, Mel.
Sure. Yep, we've gone a bit over time. That was fantastic. Thank you everyone for attending today, and thank you to the presenters. It was really worthwhile. We've got some extra questions, so I'll send those through to the presenters, and Casey will follow up with those to get back to you on them. Thank you everyone for today. Have a lovely afternoon, and please remember that it has been recorded today. You will be able to watch it on the website in the Education Library, and that the survey will pop up after this so we can get your feedback. Thanks everyone.
Cheers.
Thank you, Mel.
Bye.